All right. Well, welcome to anyone who's on time to this meeting at exactly 5:30. I'm going to give it maybe another 30 seconds before we launch in. Please ask any questions that you have. Would love to have any questions that you have, and hopefully we'll have we'll definitely leave some time at the end to get to those questions. And so now it's 5:31, so I think we should go ahead. So let me get started. I want to welcome you all to Pandia Health's first Menopause Conversation Cafe. Please excuse my background. As you know, the life of a co-founder and tech person. I'm on my way to San Francisco to have another meeting, but absolutely wanted to kick this off and launch this amazing event. I am Dr. Sophia Yan. My mom said, claim all your titles. So everybody claim all your titles. Co-founder and chief medical officer of Pandia Health. And Pandia Health's mission is to make women's lives better by bringing expert women's hormonal health care wherever you have internet and a mailbox. We are so lucky to have secured Dr. Hansen. She is a board-certified OB gynecologist with greater than 2 decades of experience. She is one of approximately 1,000 in the United States Menopause Society certified practitioners and leads our menopause division. She also has expertise in female and sexual dysfunction. And here
Thank
comes
you. Thank
Dr.
you so much. Thank you, Dr. Yan. And I love your mom's advice. I will claim my title. I am Dr. Catherine Hansen, and I am so happy to be here. It's an absolute pleasure. It's really exciting to be having our first conversation cafe together. And I hope that you will be seeing my slides shortly. I hope you have a great evening doing what founders do. And everyone else, sit back and relax. All right, let's go. So we're here to talk about menopause, and we are having, like I said, our first conversation cafe. It says we're going to master menopause. I'm quite sure by the end of our evening, we won't have it mastered, but we'll definitely be providing you with some ideas about how you can get the answers you need to master your menopause. So I will share a little bit more about me and a little bit more about what you may be experiencing. So we're going to have an opening message, who I am in a little bit more formal detail, what you could be going through, maybe not. And then I want to make this really, really tangible for you. So you walk away with 3 key things that all women over 40 need to know. And I picked the age of 40, but of course, all women need to know these things. But around that age is when we start to notice some of the changes happening in our body and in our life. So those 3 things, if you want them right off the top, are your health is in your hands. We're going to talk a little bit about where to start with that. Timing is crucial. So today is a very good day for you to get started. And who do you look to for advice? Where should you be going to get that credible information? And then, of course, wanting personal answers, we'll have a Q&A at the end, but we're also going to provide you with lots of ideas about where you can get those personal answers for yourself. So we're going to just be keeping in mind that I am sharing medical information, but it's not medical advice per se, always talking to your own healthcare provider, and we'll give you some answers about where to go for some of that information as well. But that's we're here today to talk about education and hopefully some entertaining conversation. So who am I? As Dr. Yan explained, I'm a board certified obstetrician and gynecologist, a Menopause Society certified practitioner, used to be North American Menopause Society certified practitioner. We're going to talk a little bit about the Menopause Society later today. I'm the founder of the Empowered Women's Circle, a former assistant clinical professor at the University of Texas Medical Branch out of Galveston, the wife of this Canadian astronaut who will be one of four crew going back to the moon on the Artemis 2 mission coming up. So he's a pretty phenomenal guy and a great support. Mother of 3 amazing children, and I am also a menopausal woman. So, what is menopause? Menopause is essentially a normal, natural life event. Doesn't mean it's comfortable, but for some people, it's totally comfortable. It's defined essentially as that last menstrual period, and we don't actually know we're through menopause for about 1 year or 12 months of no bleeding. And we define it that way because if we have bleeding after that 12 months, it's postmenopausal and it's probably not okay. So if you have any bleeding, if you're well beyond that 12 months, then that really needs to be investigated. So that first 12 months is kind of hit and miss. Periods can get irregular and kind of erratic. But once you're through that 12 months, your bleeding should not come back. It's a permanent cessation of menses. And it's related to loss of ovarian function. So the ovaries stop doing their ovulation every month, and so the bleeding goes away as well. So when is menopause? We know that menopause average age is around 51 in the US, and it can occur prematurely. So from having your ovaries removed or chemotherapy, radiation. And a lot of people don't realize that when you have pelvic surgery for pretty much any reason, the vasculature, the blood supply to the ovaries can be impacted, and that can actually bring menopause on a little bit earlier as well. Anytime there's an impaired ovarian function, it can be called premature ovarian insufficiency. That can happen at any time and any age and stage of life. But if it happens before the age of 40, probably needs to be investigated. And then there's this thing called the climacteric. So menopause is not actually a date on the calendar. It's a transition. It's a phase of life. And so the climacteric is around 10 years long. It's a whole phase in our life when we're starting to have the hormonal changes that relate to menopause. So we say that perimenopause meet menopause. Perimenopause is when we're in and up, and menopause seems to be when we're down and out. Everything starts to go down and out. Gravity really has its way with us. So if you're feeling down and out, you might be feeling like these cats. Having 9 lives is cool, but if I have to go through menopause again, forget it. So for some women, it really is a very debilitating phase of life. And for others, it really comes and goes without much fanfare. So whatever that is for you, that's just natural menopause. And we're going to talk about some of the symptoms and some of the things that you can do to get started being really healthy at this phase of your life. But if you're feeling this way, like the cats, you're not alone. There's over 6,000 women reaching menopause every day in the US. That's over 2 million women a year. You're definitely in a very important club. A woman's life expectancy in the US is about 81. And so we're living 30 to 40% of our lives postmenopausal. So postmenopausal women are not over the hill. We're not a minority. We're actually ruling the world. We're actually a very, very important part of the population. We're actually a huge part of the demographic. And in areas where we're not ruling the world, we probably should be. A lot of things going on at midlife as well as these hormonal changes that we're talking about. So there's aging changes, which are different from hormonal changes and sometimes can be related. There's loss of fertility. So I also work at a fertility clinic, and I'm very saddened when women come in their early, even mid 40s, and they aren't necessarily aware that they're not able to have natural children anymore. They have to use fertility treatments to do that. There's lots of those treatments available, but it's really sometimes a grieving process for women to realize that loss of fertility. On the other hand, some women never wanted to have children, or some women are done and they're really happy that their periods are going away. We can also have a lot of sleep problems related to the stressors at midlife. Sometimes some medical problems start to creep in, divorce at this age or widowhood. Empty nest. I don't like to call this empty nest syndrome because it tends to be actually for some people a bit of a revelation, but empty nest is one of those phases that we go through at the same time as we're having these hormonal changes. And then there's the sandwich generation. So we, as women in this age and stage of life, tend to be looking after children, and we're also sometimes looking after ailing parents. And we know that women carry a large part of the burden of doing those things in life, children and parents, and a lot of that unpaid work. And career progression. So at midlife, we're really hitting career momentum. We're getting those those promotions and those projects and doing those things that finally got that corner office. We're doing those things we've always wanted to do at the same time as sometimes our hormones are starting to really wreak havoc on our ability to function. So as let's talk about that's essentially who you are through several decades of being in the office with midlife women and with women at all ages and stages of life. That's generally what I have heard. And again, we're going to have a little time for discussion at the end around things that may be different from what you've heard. But now that we've covered who I am, who maybe you are, or what maybe you are experiencing, let's talk about some of the things that you can do and actually start today. So your health is in your hands, and this implies really an incredible and profound amount of self-responsibility. So there's a lot of things you can do, especially at this age and stage of your life, to keep yourself healthy. So there's physical health changes happening, hot flashes, night sweats, sometimes insomnia or sleep disturbances, mood changes, irritability. I've had people come into the office just with irritability. So they feel like, I want to kill everyone in my family and I don't know why. And so sometimes those can be some of the first, most profound symptoms. And body changes with bone, heart, urogenital system, that's the vagina and the bladder, and the brain fog and cognitive issues and not sure where the keys are. All of those things can happen related to those hormone changes around menopause. So with declining estrogen, and this graph will show you that estrogen starts to decline probably around mid 40s. I'd say ovarian function starts to decline probably around late 30s, early 40s. And then as that estrogen declines, the earliest symptoms that women generally get are hot flashes, night sweats, insomnia, and those mood changes. And that's when the estrogen's really starting to rapidly decline. Little bit later on, the bladder and the vagina start to kick in. So urogenital symptoms. So that would be vaginal irritation, vaginal dryness, and sexual pain. And sometimes some of those libido changes, sometimes related to pain, sometimes not. And also related to sexual function, so arousal and lubrication and orgasm. So all those urogenital vaginal issues can start to creep in, usually a little bit later in that menopausal stage. So sort of early to mid 50s, it can creep in. And I hate to tell you, but it gets chronically, progressively worse if it's not treated. So that's what we're here today to talk about, is really trying to preempt some of those tissue deterioration things that are happening if we don't start to be a bit proactive with treatment. And then the dotted line you see there beside the osteoporosis, that's subclinical. So the bone mass starts to fall off as the estrogen falls off. And then osteopenia or osteoporosis aren't usually diagnosed till a little bit later. And that's why we start bone mineral density screening usually around the age of 60, unless there's risk factors. So I like to say real women don't have hot flashes, they have power surges. And this is actually me out skiing on the lake. We know that there is a lot of life left in postmenopausal women. We know that as I said, we're living 30 to 40% of our life after menopause. It's time to really take our health into our own hands. So this is where we talk about being proactive, now or never. So the type of exercise that we do matters, but doing exercise matters. So many times patients will say, well, I'm on my feet a lot at work, or I have a lot of stairs in my house. If you want to be maintaining function, then you can do stairs or walking around work or getting your steps in at work. But if you want to actually maintain extra reserve so that you can eventually run around after grandchildren or really do that hike you've always wanted to do, we need to be doing exercise that stresses our system. And that type of exercise matters. I'll come back and touch on that. Certain diet, certain nutrients, key nutrients are important. And if you're not getting them in your diet, then potentially some supplements. Stress, we know cortisol has ravaging effects on every organ. So we know that cortisol has inflammatory effects, which can impact our health in really detrimental ways. So managing stress and all of the stressors that are happening in midlife are even more important for you to manage around the menopausal timeframe. And sleep could be related to hormone imbalance. A lot of people don't realize that that lack of estrogen may be leading to the insomnia. And menopausal hormone therapy is one of those things that can help you with all of those physical changes and physical symptoms. The timing with which you start doing these things, so the exercise, the stress management, the dietary changes, and ultimately the menopausal hormone therapy or managing your menopause, timing is really crucial. So let's talk a little bit about timing. We know that hormone therapy is safe in the early stages of menopause for most women. So, this is something definitely worth talking with your healthcare provider about. But if you hit the age of menopause around 50 and you're within 10 years of menopause or you're under 60, we know the vast majority of the scientific evidence tells us that it's safe for you to be taking menopausal hormone therapy and that taking it may prevent some health conditions. If it's started at the right time, it can actually preempt some of the deterioration in the organ systems and the tissues, especially the vagina and also heart and also bone. And we'll talk about that. So it may help with other time sensitive concerns like sarcopenia, that's muscle loss. I'm going to tell you about that. Bone loss, we've touched on, and we'll look at a graph on that. And happiness and joy. And why did I put happiness and joy in the timing matters? Because this phase and stage of your life is so important. You come to life with a lot of wisdom and life experience. You're in relationships that matter. You're making decisions for people that matter. And having that happiness and joy in your life is not to be understated. That's what we're here to do, is to enjoy life. And sometimes hormonal therapy, believe it or not, can be one of the things that can bring back that sense of happiness and joy. So sarcopenia is muscle loss, and it starts to happen around the age of 30, believe it or not, about 1 to 3% per year. So you're already, if you're over 30 and in this audience, you're already losing muscle every year. And when you lose muscle, you lose strength. So to offset this, the most important exercise that you can do is the most important exercise that I'm having questions here, I think, in the chat. Um, Yeah, I understand there's questions. So this is great. We'll definitely get to those questions. And if anybody wants me to pause and get to those questions from Pandia, definitely let me know. So we know that muscle strength can only be maintained through muscle resistance. So doing things that are going to weight your muscles. So that's going to be body weight training, muscle weight training, and one thing that I think most people don't realize is if we lose muscle, our metabolism falls off. So when women come in the office saying, I'm doing everything the same, but I'm gaining weight, that's because your metabolism is starting to fall off. And one of the things that can help with that loss of metabolism or that weight gain that you don't know where it's coming from is to maintain muscle or to offset that sarcopenia with certain types of exercise, HIIT, resistance training, weight body weight training, et cetera, et cetera. And we know that's going to keep us healthy and strong. When we talk about bone mass, we hit a peak bone mass around the age of 30. And we know that, for example, on the contraceptive side with Pandia Health, we can sometimes help women have a higher peak bone mass if they're on a birth control pill or the right dosage of a birth control pill, for example. So when you see sort of 30 is the peak bone mass, that's when we get all the bone density and bone mass we're ever going to get. And then we start to get to the age of 50 and estrogen starts to fall off. And we have the greatest, most rapid bone loss right around that time. And we know that sex can start to be an issue around menopause. And like I said, happiness and joy, quality of life, life satisfaction are all related to great sex. Sex has no expiry date. So if there's libido issues or pain issues, they can all be related to menopause, including arousal, including orgasm. We want to be talking about all of those things, especially in the menopausal time frame. And when there's issues, I like to say to patients that this can be purposeful because it gives us a reason to wake up, gives us a reason to really change the way we're doing things or to up level the way we're doing things and to really celebrate, to grow as humans or to realize how much we've grown as humans and to set some powerful intentions for the future. So let's dig into some of the nitty gritty. This is the 2022 Hormone Therapy Position Statement by the Menopause Society. And I'll get to the bottom line for you really quick. We talked about timing hypothesis. So we know that menopausal hormone therapy can have a positive effect on coronary heart disease depending on when it started. So when a woman starts her menopausal hormone therapy within 10 years of menopause or less than 60, there can be reduced coronary heart disease or a benefit or a protection for women. So we don't prescribe it for that reason, but heart disease is one of the number one killers of women. And so if we can reduce heart disease in women by maintaining some of that hormonal milieu, then it's probably a good idea for us to be thinking about that. But if we start menopausal hormone therapy later, sometimes the blood vessels are a little more unstable, and that can lead to potentially some worsening of heart disease. So that is why the timing matters. The other thing that we know, in addition to reducing symptoms, is that there's improved quality of life, fewer deaths from all causes for women who have started their menopausal hormone therapy in that age range, fewer heart disease, fewer risks of heart disease, fewer fractures, less colon cancer, less diabetes. And so we know all organ systems really do benefit from maintaining that estrogen level over time, depending on when you start menopausal hormone therapy. And I have to say, when you start all those other lifestyle beneficial protective mechanisms like exercise and healthy diet and restorative sleep and stress management. And I won't say that enough. I won't stop saying that because all of that goes together. So when we look at hormone risk, we know that in the age range I was mentioning in that under 60, I want to draw your attention to the dark blue line. So when we compare in timing wise, when people start their hormone replacement therapy, there's less coronary heart disease, there's minimal impact on stroke. I'd say minimal impact on venous thromboembolism. That's blood clots in the legs that can break off to the lungs. And we know in that age range under 60, that can happen, but it's still low risk. There's less breast cancer and there's less overall mortality in that dark line, which are those women under 60. So we really want to hit this early and we really want to hit it with the appropriate medication. Now, the appropriate medication in terms of route of administration is going to be a patch or a pill. And we know that the patch, because it doesn't go basically through the liver the same way, avoids the increased risk of blood clots and the increased risk of therefore stroke, heart disease, etc. So if you were to take your estrogen in a patch, it's going to be a little bit safer for you than if you were to take it in a pill, and it's not going to impact the breast cancer risk. So in the middle of the slide there, you see where if you do take it orally and you have it go through the liver, there can sometimes be an increase in cholesterol or triglycerides, an increase in inflammation or clotting factors. But if you use it as a patch, sometimes it can be safer. It doesn't have as much of an impact on those clotting mechanisms. So the bottom line, and this is Dr. Yen, who you just met, is showing us that transdermal estradiol patch at a starting dose that we can titrate based on your symptoms, and prometrium, which is an oral progesterone that you take nightly if you have a uterus. And that is the bottom line, a transdermal estrogen and a prometrium pill taken at night. Those are bioidentical or body identical hormones that are FDA approved, that are titrated according to standard dosing, that are tested for safety and efficacy. And for vaginal symptoms, to consider a cream or this other medication, which is taken orally, called a SERM, a selective estrogen receptor modulator. Those target the vagina. And of course, there are non-hormone options, but we're sort of focusing on hormone options because we know that those will also have those beneficial health effects if you're a candidate for hormones. And who do you look to for advice? So that's why we're here, because we want to share a little bit about who to talk to when you have those important questions. And this is me. I spent a couple of years just before the pandemic touring the country talking about menopause with healthcare providers and with women. And it was very obvious to me that a lot of women were getting a lot of misinformation, disinformation, weren't sure really where to go. And so this was a really a fun way to spread the love. And the pandemic sort of stopped that. And so we're having these virtual conversations now, and we're able to reach even further. So, Menopause Society is the place to go. So, the website still looks like this, the North American Menopause Society, but very soon they'll launch their new website, which will say Menopause Society. They've changed their name. And you should be looking to a Menopause Society certified practitioner for your menopausal advice. So, you're going to be getting the most credible advice if you go to a Menopause Society certified practitioner. So, Menopause Society position statement that we're talking about tells us that 50 to 80% of midlife women use non hormonal therapies for their vasomotor symptoms, their hot flashes and night sweats. And yet, menopausal hormone therapy is safe. So, why are so many women doing that? And 3/4 of women don't feel fully informed or really confused. So, if you're in that category, you're not alone. It is a confusing space. And if we're not sure what to do, we can use really inappropriate or ineffective therapy. So there are some dangerous therapies out there, and if we're not sure what to do, there's a delay in getting to the effective therapies. And I hope I've made it really clear that timing matters. We don't want to be delaying the use of menopausal hormone therapy, which could be protective or preventing certain conditions. And we definitely don't want to be underusing what could be effective for health. So, what are some of the dangers to avoid? I'm not going to get into great detail, but I will tell you there's dangers out there. For example, compounded hormone pellets have been actually found to have a lot of adverse effects. They're not FDA approved, they're not very safely tested in the randomized control trials. So, they're really something that's out there as a commercialization of menopause, as a way for people to make money around menopause. And I dare say there have been some pretty glaring reports about some of the things that can go wrong. I've also seen people in the office with some of these adverse effects. It can be quite sad, because if women are not informed about what could go wrong, it can be sometimes quite a shock to hear that that's not a safe form of menopausal hormone therapy. And then there are doctors who are sometimes going to a little bit toward, I call it the dark side, sort of the controversial therapies for menopause. And there have been doctors disciplined for doing that, but there's lots out there who are still doing it sort of among the celebrities. So being really careful. It can feel like you're drowning in information or misinformation or disinformation, but we're here to get you grounded. So let's wrap up with how we're going to do that. We're bringing the answers to you. We can't get them all to you in 45 minutes, but Meaningful Menopause is a program that I run. It's 5 weeks, hormone harmony and holistic health, and Pandia Health. And we're going to share a little bit about both of those right now, and then open it for Q&A. So Meaningful Menopause is a 5-week program. It's run live digitally with me. It's hormone harmony and holistic health. It only takes us 5 weeks to cover everything. We can't, again, do it in 45 minutes. It starts in January. It's 5 modules, live sessions. If you can't make them, there's recordings. I recommend you get on the email list, and eventually I will share with you a lot more information about that, including how you can get a discount on that, and continue providing some of the tidbits and breaking down some of the information that we've just started to unravel a little bit this evening. So drkatherinehansen.com is where you go to find out more information about that. You'll find a tab for personal services and workshops. And I hope that you'll join me for that. And Pandia Health has a telemedicine platform we have one for contraception, and menopause is coming really, really soon. So from the comfort of wherever you are, Pandia Health is going to bring us some really credible, compassionate, and evidence-based care from menopause certified practitioners, myself, Dr. Stephanie Culver, who I believe is probably with us, and a lot of the remainder of our medical group at Pandia Health, who are really excellent care providers, all physicians, which you will not find anywhere else in the telemedicine space, and looking after you in a really personalized, compassionate way. So, with that, I'm going to hand over to our powerful and fearless Pandia Health CEO, Alice Iweda. Alice, are you with us?
Hi, thank you so much, Dr. Hansen. Really a huge heartfelt thank you for all your wisdom and grace leading us through this really important topic. I learn so much from you every time I hear from you, and I hope everyone feels the same. I'm Alice Iweda, CEO of Pandia Health, and I'm thrilled to let you know that we are opening our menopause practice. Really good news for you all today. We feel passionately that you should not suffer in any way, shape, or form. We want you to thrive and live the fullest life that you can live with your partners, with your children if you have them, with the important relationships in your life. And we want you to get that care and have the symptoms resolved because there's no reason to go on struggling and living with any symptoms related to menopause. So I'm thrilled to say that we will shortly be announcing a discount that you can receive for your very first consultation. Our care program is overseen by Dr. Hansen herself, who, as you know, is a certified practitioner in menopause care. So we are really excited to connect you. And before we do that, I'm going to go to our Q&A and make sure that we address any of your immediate concerns today. So more to come. Let us go and check out some questions together.
Yeah, thank you so much, Alice. So I'm seeing a highlighted question that says, I feel weakness is from depression, laying in bed, not going out. And so my comment is very, very likely, laying in bed, not going out is definitely going to lead to not just the sarcopenia, but also muscle weakness over time. I have to be honest, when I talk with patients about this muscle weakness and muscle loss and how important it is to maintain strength and balance and metabolism over time, I usually recommend daily form of exercise. I know that sounds like a lot, but it's not only good for getting out and moving your muscles, it's also good for depression. So moving, exercise, activity, being in nature is actually one of the treatments for depression for sure. And if depression is something that feels like it's the main symptom or the main concern, then that, obviously all of these things need to be assessed by a healthcare provider, helping to determine if the depression needs treatment or if the menopause needs treatment, and adding to that some form of mild movement and being in nature will probably help the cognitive symptoms as well. And the next question is, what is the controversy around pellets? Yeah, really good question. So the controversy around pellets, there's many areas that I could touch on here, but one is that the dosages are not studied to be necessarily the standard evidence-based dosages. So pellets have different estrogen, progesterone, and testosterone dosages in them than would be otherwise prescribed in menopausal hormone therapy. Pellets normally have testosterone in them, and testosterone for women has a place, but it has a very specific therapeutic need and guide. It's not something that we give to all menopausal patients, and it's actually not something that's necessarily needed for menopausal patients, and yet pellets have testosterone in there, and sometimes quite a bit. So the adverse effects that I have personally seen in the office are uterine cancer, because sometimes the pellets don't have the right balance of estrogen and progesterone in them to protect the uterus from cancer. So I have seen precancer and uterine cancer in the office from pellet therapy. I've seen also, I'm just speaking from my own personal experience, I've seen clitoromegaly, which is where the clitoris starts to grow a little bit big because the testosterone dose in this woman's pellets were too high. And that clitoromegaly, where the clitoris starts to grow, is actually not reversible. and deepening of the voice, as well as oily skin. So there's a lot of things that can be really related to taking estrogen, progesterone, and or testosterone in dosages that are not tested for safety or efficacy, such as in pellets. Okay. So this sounds like sort of a personal story a little bit. So let me just read it here. And I'm curious, can the audience see the questions or just me? I'm not sure. But the question is, had hysterectomy around 2012, patches and had memory loss. So cut the patches in half, then tried a cream, basically been on no hormones for 10 years. I have depression and anxiety. Yeah, I'm not sure what the question is there. So I think I'm not sure what your question is. Maybe it's time to go and see your doctor about specifically the depression and anxiety. If you had your hysterectomy in 2012, that I'm doing the math. Doing the math here. That's 11 years. So you've been 11 years, at least 11 years postmenopausal. I don't know how old you are. And that would mean that starting the standard sort of bottom line menopausal hormone therapy we talked about tonight, you're not really in that window. So definitely talk with your healthcare provider about what would be best for you. And if your main symptoms tend to be depression and anxiety and not hot flashes, night sweats, vaginal issues, then you want to treat the symptoms. You don't want to just take something that you don't need. Yeah. If my period ended late around the age of 58, does that mean I go through menopause quicker? No, not necessarily. So, menopause, it doesn't matter when you go through it, the menopause is still 1 year after that last period. So, if you had your period at 58, you didn't have one for a whole year, and then you hit menopause, you did menopause at 58 or 59. That's okay. And in fact, there's probably some pros and cons to having a late menopause. That's totally fine. Yeah, there's a ring you can put in your vagina for 3 months to get vaginal estrogen. Absolutely. So that would be a vaginal estrogen. Vaginal estrogen comes in a cream. It also comes in a ring. So there's a couple of different rings that can go in and slowly release estrogen around the vagina. They also help with genital urinary syndrome of menopause, which is vaginal and vulvar and bladder symptoms. So that ring can work really well. And thanks for the reminder, Julie. I'll add that to the slide. I've used that ring many, many times, and patients generally like it if their symptoms are purely vaginal. And yeah, what's a SERM? A SERM is a selective estrogen receptor modulator. So it affects estrogen in certain tissues as an estrogen, but it's an estrogen blocker in other tissues. So it's a really cool medication. So there's certain ones on the market that we use to prevent high-risk breast cancer in patients who are high risk for breast cancer. There's certain ones on the market that we use for bone because they're estrogen at the bone. And then there's one on the market that is an estrogen at the vagina, but it's not an estrogen at the breast, and it is an estrogen at the bone. So it actually targets the vagina, but has other bodily effects. And it's oral, but targets the vagina. So it's kind of really cool how it works. It's called ospemifene. Yeah. And so for those at risk of stroke because of a family history, what's the best plan? Well, I think we saw in the literature and in the graphs that the risk of stroke, if menopausal hormone therapy is started at within the first 10 years of menopause and definitely under 60, the risk of stroke is probably low enough, and I won't say protective, although we did see some of the graphs showing that, but low enough that it's worth weighing out the risk benefit profile for you. So in other words, what is your cholesterol? What is your blood pressure? Do you have diabetes? What is your weight, for example? So the risk factors for you for stroke, as well as your family history, and looking at all of that together, and depending on age and risk, taking menopausal hormone therapy probably doesn't have a huge increased risk of stroke for people in that first 10 years. So high blood pressure. So with high blood pressure, which is a risk factor for stroke, We want to make sure the blood pressure is managed for many, many reasons. But if the blood pressure is well under control, it's not a contraindication. So, in other words, you don't have to not take menopausal hormone therapy purely because of blood pressure that needs to be controlled with medication, but it's not in isolation. So, I would ask your doctor about all those other things I just mentioned. What's your diabetic risk? What's your cholesterol or triglyceride level? What's your diabetic or your weight like? So other than your blood pressure, you really want to look at the whole picture, but it's not by itself a contraindication. Yeah. So testosterone gets prescribed as one of the bottom line hormone replacement therapy, or is it all dependent on testosterone levels? That's a great question. Testosterone is not something that I normally recommend. So I have used it with patients, but it's in very specific situations. So there's this sort of thought out there that if I take testosterone, I'm going to be able to build muscle, I'm going to be stronger, I'm going to have more energy, I'm going to be more vibrant. And in fact, testosterone may actually make you feel that way. But the levels of testosterone that a lot of women get from sort of these clinics or places that are maybe not advised about menopausal hormone therapy are higher than the female physiologic range. And so having your testosterone higher than the female physiologic range, although it may feel good, is probably not good for your body over time. So the ways that I would use testosterone would be very, very sparingly in very few patients for very specific reasons. And happy to dig into that more. But it's not part of standard menopausal hormone therapy at all. And yeah, I've never been on any hormone therapy and been menopausal for 16 years. I'm 62. Yes. Okay. So the question is about vaginal pain. So even though whether people are sexually active or not sexually active, vaginal pain related to menopausal estrogen loss in the vulvar vaginal tissues can be treated with vaginal estrogen and should be if it's uncomfortable. So vaginal estrogen can be taken, like we said, in a cream. One of the people here reminded me, of course, about the rings. Those are great. But vaginal cream is probably the easiest way. And then the serums that we talked about. Vaginal cream or the rings will definitely help with that vaginal discomfort, whether you want to be sexually active or not. And it may also protect other bladder or vulvar vaginal related things like irritation, infections, overactive bladder, urinary urgency. So really good idea to get that treated if it's uncomfortable. And Alice is our CEO is letting us know that we have an offer on the table. So a VIP offer for $30 off your initial consultation with Pandia Health. Sign up for our VIP, and the link, I believe, is in the chat. Thank you so much for sharing that, and I'll hand it over to you.
Thank you, Dr. Hansen. Yes, I'm excited to share this offer with you all. I appreciate that some of you may be able to click on the link. If you can't, then you just simply navigate to pandiahealth.com/menopause. Sign up for our VIP list and you will be receiving an offer by email shortly. I am thrilled that you'll be able to get the care that is overseen by Dr. Hansen, because you really are in safe hands and will be getting extremely high quality care from one of the best experts in the country. So please share the love, let your friends know that we are offering this service, because we know that, you know, powerful, influential women talk to other powerful, influential women. And I have no doubt that many of you are feeling that way today. And if you're not, we want to get you there. So thank you. We are committed to hormonal health in every shape and form for women at every stage in life. So please reach out to us. Feel free to reach out to someone on the chat on our website at any time. And yeah, we're excited that you joined us. We're thrilled that you're educated on this topic. Continue to learn, continue to grow, continue to thrive in your lives. And we are here for you. Have a wonderful evening, everyone. Thank you again, Dr. Hansen, and see you all soon. Take care.
Good night. Bye-bye.